first format, the format to follow include one, that we need to take brief history from the patient. If the patient can talk, if the patient can speak, we take brief history from the patient. If the patient cannot talk, we take brief history from the patient's relative. And what does this brief history constitute of? It consists of three words, three things. What happened? When did it happen? And how did it happen? It's just to give us an overall idea. What are we dealing with? Is it a case of trauma, like a road traffic accident? Is it a case of a myocardial infarction? What exactly are we dealing with? So we have an overall idea of what it is like. What happened? When did it happen? And how did it happen? As soon as we get these three things, we're now moving into action to resuscitate the patient. And we said to resuscitate the patient, we have to use the A, B, C, D, E approach of resuscitation of the patient. After you have resuscitated the patient, we will have to move on now to the detailed history. And we're able to talk about how the format for detailed history yesterday. What did we talk about in the detailed history? We said we are going to make use of the 5 C's to take our history. What are these 5 C's? We said the first C is the chief complaint. After we have stabilized this patient by resuscitating the patient, if the patient can talk, if the patient can speak, we'll now move on to the patient, approach the patient. Sir, can you tell us now what happened? How did this happen? Why did you come? How did this happen? Patient will now tell us, oh, I was completely fine. No, I was okay. Before I know it, the next thing I remember, the last thing I remember is I was sitting down. I didn't know anything again. I now wake up to find myself on the hospital bed. That is it. Okay. So the chief complaint now here will be what? He fainted, lost consciousness. So that is the chief complaint. The patient collapsed, loss of consciousness. Presenting complaint, loss of consciousness. When did it happen? 6 hours ago, 4 hours ago. So we have to take note of it. It happened 6 hours ago, or it happened 4 hours ago. So chief complaint, loss of consciousness. So the second C now is the cause, which we spell as COURSE, cause. So this cause means, okay, since this problem started maybe 6 hours ago, what has happened? That symptom, is it getting worse or is it getting better? Cause. So is it getting better? Is it getting worse? So in that course as well, we talk about, are there other symptoms? Are there other symptoms that this person is having? Are there other associated symptoms? Apart from this loss of consciousness, did you had headache before the loss of consciousness? Did you have blurring of vision before the loss of consciousness? So did you have cough before the loss of consciousness? So in that pause, we have to, after asking the duration, when did this problem happen? And if was the problem getting worse or was it getting better? We also ask about the associated symptoms. The associated symptoms. Was there headache? Was there blurring of vision? Was there inability to move any part of your body before you lost consciousness? So all of these things are included in the course, COURSE. So after that course, the next thing we want to go into is cause, the cause of what is causing it. In other words, the etiology. So I want to look into what probably might have caused this problem. So that is the cause. So in the course, we are going to ask about risk factors for loss of consciousness. Ask about risk factors. So what are those things that might cause somebody to lose conscious? Okay, did you eat this morning? Why? Why are we asking if the patient ate this in the morning? Because we want to rule out hypoglycemia, because hypoglycemia is one of those things that can cause somebody to lose consciousness. Okay, what else can we ask? Okay, are you a known hypertensive patient? Okay, we want to establish maybe this patient is a known hypertensive patient and he has probably used overdose of his antihypertensive medication, making his BP to also drop. Making his BP to also drop. So hypotension probably make the patient to lose consciousness. So we are still trying to look at what might have caused him to lose consciousness. So that is cause. The cause. What is cause? What caused the problem? After this, the third C, which is cause, CAUSE. We want to go into complication. Is there any complication that has happened since this problem started? Is there any complication that have happened since this patient problem started? So that's the complication. What are the expected complications that might happen? Okay, fine. The patient lost lost consciousness, and probably the patient was sitting, right? And when this patient lost consciousness, the patient must have fallen down on the floor, and probably there might be maybe a sharp object on the floor, which probably might have injured the patient on the stomach, on the tummy, or on the chest. So it's a complication. He sustained a penetrating injury from the fall. So that is a complication. It's a complication of the fall. So that's what we want to know. Is there any complication that has occurred since this onset of the problems, since onset of the symptoms? So after this complication, we also remember that complication is the fourth C. After the complication, we also remember to ask if the patient is a non-patient with any medical problem before now. So we should remember to ask that, is he a non-diabetic? Is he a non-patient with asthma? Is he a non-patient with chronic obstructive pulmonary disease? So we'll ask all of these things. After that, past medical history, we're now going to care. Okay, what is care? That is the fifth C, which the fifth C and the last C. What is the care? So, okay, this thing started 6 hours ago. Since it started, did any of your family member do anything? Did they buy medication? Did they give you anything? Have you received any previous treatment, any prior treatment before coming to our hospital? Did they take you to any other hospital before you come to our own hospital? I just want to know, did this patient receive any care before the person now comes to our hospital? So that is the last care in the 5 C's. So after this last care of 5 C's, also remember to ask the social history. Do you smoke? Do you drink alcohol? Do you take herbal concoction? So this is the body of the history, the sequence of the body of the history. But we should have in mind that before taking this history, we need to take the biodata, which we explained in detail yesterday, the biodata. So we want to know the name of this patient, we want to know the age of the patient, we want to know the sex of the patient, we want to know the occupation of the patient, we want to know the tribe of the patient, we want to know the religion of the patient, we want to know the address. Where does this patient live? We also want to know if the patient is married, marital status or not. So these forms testing. So the examinations, and we are in the examinations, the examination aspect of this sequence of attending to a patient. So the first examination, which is the first thing you must do whenever a patient comes to you, is general physical examination. So how many examinations do we have in medicine? The examinations are divided into general physical examination. So you can also jot, you can write if you want to jot some things, you can jot some things down. Just like some of these things I'm saying, the current things I'm saying now are not in this slide. So please take some notes, jot them down. So we have general physical examination, which is the one we'll be talking about today. After general physical examination, in that sequence, that is how we always like to approach it. Approach it in that sequence. The first one to do is general physical examination. The second one is cardiovascular examination. So in the cardiovascular examination, we want to examine the heart to see if we can pick up any pathology that is related to the heart. So the third one we are going to do is the lungs, which we call a chest examination or pulmonary examination. Anyone call it chest examination or pulmonary examination. So that's the third one we do. So the fourth one we do is abdominal examination. Abdominal examination, where we examine for pathologies of the liver and gastrointestinal system. And the fifth one we're going to do is the nervous system examination. The nervous system examination. So routinely, we will do 5 examinations when we're attending to our patient. That is routinely what is done on a routine basis. But is that the only examinations that we have in medicine? No, not at all. We have joints. The joint is on its own, where we examine the joint because a particular joint is having a problem. We have eye examination, where you examine the eye. We have ear examination. But routinely, what is being done on a routine basis is those 5: the general physical examination, the cardiovascular examination, the chest or pulmonary examination, the abdominal examination, and the nervous system examination. So we're going to try to cover these 5 routinely done examinations. So the first one we want to start today is the general physical examination. So I would want to tell you that in this slide I'm using, I'm going to forward it to the WhatsApp page. But in this slide I'm using, a lot of things are included. It's kind of more detailed, and it's added some things that should not be in the general physical examination. But as I'm saying, that's why I said you should try and make some notes, make some jottings, so that you follow what I'm teaching in this sequence. When you go through the slide, you select those ones I have said and master them. There are some other things that are added that should not be in general physical examination. For example, joint examination is not part, that is separate. Joint examination is separate from general physical examination. And things like checking of blood pressure and pulse rate, those ones we reserve them for cardiovascular examination when we'll be doing cardiovascular examination. That is to examine the heart. So those ones we don't include them normally on general physical examination. Okay. So general physical examination is a fundamental aspect of a patient care, assessing overall health and identifying potential medical issues. So it is very important. These examinations are very important because I must tell you, in some patients that will come to you as a paramedical personnel, as a physician assistant, or as a nurse, you may not be able to pick any tangible history. That is the truth. You will ask a patient or patient relative, sir, ma, what is the problem? He say, I don't know. He's not feeling fine. So the only history you can get, he's not feeling fine. So he's not feeling fine. We know he's not feeling fine, but what exactly is going on with him? And nobody will be able to volunteer any history, anything that you have at hand to work with. So in those cases, you must rely on your examination findings. What did you pick on examination? That is what will tell you this is what this patient is having. So you go ahead and treat the patient based on what you have found on the examination. So that is why it is important. So how do we start this general physical examination? There are some precautions that we must take before we start general physical examination. The first thing is that you must wash your hand. Hygiene is important. Hmm? You must wash your hand very well. So when you wash your hand, you go walk onto the patient. You introduce yourself. Tell the patient whom you are. I am so and so person. I am Paul. I am I am a physician assistant, or I am Paul. I am a paramedic personnel. I will be the one that will be attending to you until a doctor will come to take over from where I have stopped. You have introduced yourself, you are Paul, you have told the person whom you are. I'm a nurse. I'll be the one that will attend to you until the doctor will come and continue from where I have stopped. I'm a paramedic. I am a physician assistant. So you introduce yourself and tell the person what is your position. So after that, you will now tell the person the type of examination you want to do. Hmm? As I want to examine you from head to toe. I want to know what you are having. So you have explained to the person I want to do. When you say examine you from head to toe, you are telling the person I want to do a general physical examination for you. I want to do a general physical examination. So you have told the person what the examination you want to do. So after that, the next thing you are going to do is privacy. You cannot start examining the patient in an open place. So we do what we call screening. So we do what we call screening. What is screening? Like screening is bringing in a shield. If there's a curtain in that place, you make sure that the curtain is covered so that it will be only you and the patient that will be in while you want to examine the patient, or unless there is any other medical personnel that can be while you are examining the patient. So you also have to tell the patient relative to excuse you. So let them wait outside so that I can be able to attend to the patient properly. So please, can you just excuse us a little so that I can examine the patient? So that is privacy. Again, remember that if this patient is, if your sex is opposite to that of the patient, you need a chaperone. So if you are a man and you want to examine a female, it is always good to call in a female medical personnel to come and stay in there, so that there won't be any issue. Maybe somebody accusing you that maybe you did what you are not supposed to do. So if you are a female and you want to examine a man, you should call in a chaperone, calling in a male person to come in and be that place while you want to examine the patient. So please make sure that all of these are in place before you start. Please, Blessing, if you don't have a question, please kindly mute. Thank you. So we must make sure that all of these things are in place before we start the examination. One is hand hygiene. Two, proper introduction. Three is screen your patient. Four is explain to the patient. Explain to the patient what you want to do for the patient. After this one now, the next thing we want to do is exposure. Exposure. So we want to open up the patient, want the patient to expose him or herself. So that is why we cannot do this in an open place. We must screen the patient. So exposure. What is the right way to expose a patient for general physical examination? Because general physical examination, we want to see everything in person's superficial body, from head to toe. So the first thing we want to do is we cover the private parts. So we tell maybe a head attendant to help us bring in a bed sheet or cover clothes. So with that bed sheet or cover clothes, we give to patient relative, or if the patient can, we give it to the patient. Or patient can get a gown and give gown to the patient. So what are we trying to do? We want to cover, if it's a woman, cover the breast, make sure that the breast is not outside, and cover the pelvic area, the vagina. So if it's a woman, if it's a man, we want to cover the private part, we want to cover the penis, the pelvic area, cover it, make sure it's not showing. So those are the two important places. So for a woman, breast and the vagina area. For a man, the penis and the gluteal area, cover it. Mm-hmm. So that is exposure. So you want to expose the patient. So after this exposure, the next thing we want to look at if there is anything that is attached to the patient. Is the patient on oxygen? Because we must report it. If the patient is on oxygen, when we are reporting our general physical examination, we must report it. That is even telling us the severity of the illness, the severity of the sickness. So you must take note, the patient has oxygen connected to the nose, the patient has IV fluid attached to the hand, the patient has urethral catheter attached, that is catheterized. So must take note all of these things that is attached to the patient. So after we have taken note of all of these things that are attached to the patient, the next thing we want to do is, where are we going to examine this patient from? So when I was giving you class, I think the first day, I specified it, I emphasized it that you must make sure that you stand on the right hand of the patient. Do not examine patient from the left side. You must always stand on the right side. In fact, it is so serious that in medical school, if a medical student is examining a patient from the left hand, if that is an exam, the medical student has automatically failed. A medical student is carrying out an examination patient. If that medical student stands on the left-hand side, if it is an exam, that person has already failed. So it's advisable to stand on the right-hand side. If you stand on the right-hand side, you'll be able to review the patient perfectly, very well, without any difficulty. Okay, so we'll stand on the right-hand side. So that is the next thing. So now, haven't given class on the first thing we want to do. I've explained all of those initial things. I want to take questions before we move ahead to be sure that we are on the same page. If you don't have questions, please indicate that there's no question so that we'll move ahead. I can see Titilola and Blessing. Please indicate if there's a question you ask. If there's no questions, just indicate there's no question so that we'll move on. You can also type in the chat box. Please, if you can hear me, indicate that you can hear me by either typing or muting yourself to speak. Okay, no question. I can hear you. Okay, good, fine. So we'll proceed with the class now. Okay, now we have said all of those initial things we need to do, how to position a patient, how to expose a patient. Now, the examination in medicine and pediatrics follow a mnemonic, which we'll call the mnemonic as IPPA. We use a mnemonic called IPPA. What does I stand for? I stand for inspection. Inspection. I stand for inspection. So we want to inspect the patient. I stand for inspection. We want to inspect the patient. The first P stands for palpation. The third P stands for percussion or percussion. inspection, palpation, percussion, and the A stands for auscultation. Auscultation, IPPA. IPPA, inspection, palpation, percussion, and auscultation. So all the examination in medicine and pediatrics, that is the format they follow. Or we must do one before the other. So we must inspect. After inspecting, we will palpate. After palpating, we will percuss. After percussing, we will auscultate. However, in general physical examination, we don't have percussion and we don't have auscultation. So in general physical examination, we only have inspection and we only have palpation. So we are going to inspect the patient and we are going to palpate the patient. So inspection simple means looking. We look at the patient. We look at the patient from the head to toe. Look at the patient from head to toe. After inspecting the patient, look at the head, look at the chest, look at the tummy, look at the leg. After that, then we'll now start palpating. So palpating means touching. In palpating, we'll touch the patient. In palpating, we'll touch the patient. So percussion, we're not going to talk about percussion because percussion will be used in other examination, but percussion simply means in percussion, we use finger, we press it, we place our palm, the palm of our left hand on the patient's body, especially the chest. It's usually done in pulmonary examination or chest examination. So we use the palm of our left hand, we place it on the chest, and we use the pop or the tip of our middle finger, and we knock on our middle finger as well. The middle finger that the palmar surface, we are place it on the chest. So we knock, and we'll hear a noise that is coming out from my finger like this. So with that sound on the chest will help to tell us if there's any feature of consolidation, that is the chest has consolidated to become solid. The lungs have consolidated to become solid instead of the air that we're supposed to have, if there is fluid. So that is what we call percussion. So auscultation means we have to use stethoscope. We use stethoscope and we listen to the chest and listen to the heart to see what we are going to find out. So that is IPPA. But we said in general physical examination, we're only going to make use of inspection and palpation. So when we're inspecting, what are we looking for? We are looking for, maybe we are going to see some rashes on the patient's body. We are going to see some patches, hyperpigmentation. We are going to see area of redness. So those are things we are looking for in those are the things we are looking for in inspection. That is looking. Sorry. So I'm coming. My slide is not moving. I'm trying to check on why it's not moving. Okay. Okay, let me try and share. Let me try and share the slide again. Okay. Okay, so we are talking about inspection in general physical examination. We're talking about inspection. So fine. In inspection, these are what we're expecting, like the hyperpigmentation, just as we are seeing in this patient. Increased pigmentation of the skin. We're seeing increased pigmentation of the skin. So those are things we see in inspection. We are taking note of those things. Look at this now. What are we seeing here? We're seeing hypopigmentation. In the other one, we saw hyperpigmentation. Here we're seeing hypopigmentation. And this case is a patient that likely has what we call vitiligo. What we call vitiligo. We don't expose the patient very well, we will not be able to find some of these skin features that we're supposed to see on exposure. So what are we seeing here? Now we're seeing areas of markers in the second image, area of patchy hyperpigmentation. In this particular child now that we're seeing here, now we're seeing what we call papules, which is raised spots on the patient's face. And here we're seeing pustule. Pustule. This graph will call in layman language, we'll call this one boil. So we want to expose the patient so that we can be able to see all of these skin findings. So these are things we'll look for in inspection. We want to inspect the skin. We want to inspect the skin. So it's not only we're looking for this, we're also looking for are we going to see things like a scarification mark? Are we going to see keloid? Are we going to see scar tissue? And when we see scar tissue, what does it tell us? It tells us that if you see scar tissue in some region, it tells us that this person probably might have had surgery before. So people who have had surgery, you will see scar tissue at the area of the heart. Some people might have had appendectomy before. So you see scar tissue at the right lower quadrant of the abdomen. So people might have had a cesarean section before. You will see scar tissue in the midline, in the suprapubic area. So just by inspecting the patient, you can be able to pick that, this person have had surgery before, or this person have had this before, have that before, just by seeing what is on that skin. So what these things are some of the skin findings that we're going to see. We take our time to inspect the skin of this patient. So this is what we'll do in inspection, so that we can be able to pick some of these finds, some of these features. Okay, fine. So after inspection, what next do we need to do for this patient? What next do we need to do? After inspection, what next do we need to do? So after inspecting this patient in that sequence, please, if you are not writing, write, note these things down. That is what we do. If you are not writing, please write, take note. Take note, because as I've told you before, it's not everything in this slide that we do. There is some other additional things that are in this slide. Is much more this thing than we do. So there are some other additional things. So if you're not writing, write this part, because that is the sequence, the sequence of things, the way we do things, at least in teaching hospitals in Nigeria. So after inspection, the next thing we want to do is to start the examination from the head. Is to start the examination from the head. What do? We want to look at the hair of this patient, the hair. So is the hair of normal consistency, or are there abnormalities in the hair of the patient? So does this patient has any abnormality in the hair? So the hair can be very soft. The hair can be very soft to the extent that you can be able to plug. You can be able to plug out the hair. You can grab the hair and pull the hair out. You can grab the hair and pull the hair out. When you can do this, if you can grab the hair and pull it out, we say the hair is fluffy, a fluffy hair. What's a fluffy hair? A fluffy hair is a soft hair that can be easily plucked out, a soft hair that can be easily pulled out. So when we see a fluffy hair, what does it tell us? A fluffy hair is to tell us that there are some problem going on in this patient. It's either the patient is malnourished, the patient is not feeding well, so the person is lacking protein and albumin in his or her blood. So that's fluffy hair. Fluffy hair means low protein level, low albumin level. The protein level is low, the albumin level is low. So it must be because this person have not been eating enough protein, the person have not been eating well, or it might be that there is a liver problem in this patient, or it might be that there is a kidney problem in the patient. So these are possible causes of a fluffy hair. They are possible causes of fluffy hair. So we're touching the hair. You can see how why these examinations are very, very, very important. So by touching the hair, we can be able to dictate, you can be able to pick that, this person might be having a liver problem, or this person might be having a kidney problem, or this person might be malnourished. Might be malnourished just by touching the hair and feeling how it feels. It's soft. We can easily pull it out. We say it is fluffy. If it's not fluffy, we say that the hair is of normal consistency. So after the hair, what next do we need to do in general physical examination after touching the hair and feeling for the hair? After touching the hair and feeling for the hair, the next thing that we want to do in the general physical examination is to check. The next thing we want to do for general physical examination is to check for cyanosis. Is to check for cyanosis. How do we check for cyanosis? As you can see in this picture now, as you can see in this picture, this woman, what can you people see from the picture? The lips are bluish. The lips are bluish. They are bluish. So when we look at the lips will become blue instead of having the normal fair color that is supposed to be or a little bit reddish. The lips will be blue. So when we see a blue lips, we say the person is cyanotic. We also tell this person to bring out the tongue. We'll now say that the tongue is also bluish. The tongue is also bluish. So when we see this, we say the person is cyanotic. What are the possible causes of cyanosis? Is lack of oxygen. Cyanosis simply means there is not enough oxygen in the person's body. No oxygen, low oxygen level. That's what cyanosis connotes. It connotes low oxygen level. So general physical examination is very important. I keep on telling you guys. Because if this patient if the patient comes to the accident and emergency unit, and I'm looking at the patient lip is bluish, is cyanotic. It's telling me that this patient have low oxygen level. So immediately I'm going to start thinking what is making this patient to have low oxygen level. So my mind will go, low oxygen level. Okay, probably the heart. Maybe this patient have heart issue, have heart problem, or maybe the lungs. He's not having enough oxygen flowing through the lung and out of the lung. It could also be the kidney, because if someone that have kidney problem, the kidney problem can cause the person to have a lot of fluid in the lungs, which can also make the person to become cyanotic. Okay, seems somebody has a question. Let's see. You can't hear me. Okay, please, if others can hear me, can you indicate you can hear me so that I can know where the problem is? If it is from if it is from Blessing's part, or is it from my own part, so that I can log in and log out and log in back. If you can hear me, please indicate that you can hear me by putting in the chat box, please. Ah, okay. Titulola can hear me. So please let Blessing try to log out and log in back, please. Okay. Can Blessing please log out and log in back to make your internet better, please? Okay, while we wait for that, let me continue with the class. So we said after inspection of the patient, the next thing that we are going to do is to examine the patient. We have inspected. The next thing is palpation. So in palpation, we are going to palpation simply means touching the patient. We are touching the patient. We are palpating the patient. So in palpation, we are going to start from the head to the toe. So as we said, in the head, we are going to touch the hair for fluffiness, what we call fluffy, fluffy, F-L-U, F-E, sorry, F-L-U-F-Y, fluffy, 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 F-L-U-F-Y. So we say the hair is fluffy. We say the hair is fluffy when the hair is soft. It is soft and you can easily pull it out. You can easily pull it out. It just look like the hair of a woman who has just retouched her hair. The woman has just retouched her hair, the hair will become soft. But the difference between a retouched hair and a fluffy hair is that a fluffy hair can easily be plucked out. If you just try to pluck one of them out, it will easily come out. But a retouched hair, a retouched hair of a woman will not be easily plucked out. But both of them will look soft, will feel soft. So that is the hair texture. So we said when a child has a fluffy hair, what does it connote? What does it tell us? We say a fluffy hair means there is low protein level, low albumin level. We say this can be because of either the person has a liver problem, or the person has a kidney problem, or the person is malnourished. The person is malnourished. So after touching the hair for fluffiness, the next thing, so before I even go to the mouth, the next thing we are going to look at is the eyes. Before we go to mouth for cyanosis, is the eyes. So there are two things we are going to examine in the eyes. We are going to examine for pallor. But we are going to examine the patient for pallor. And how do we examine for pallor? What does pallor stand for? Pallor stand for pallor means pale. Pallor means pale, that the person is pale. It stands for shortage of blood. That the person doesn't have enough blood in the body. The person doesn't have enough blood in the person doesn't have enough blood in the body. So there are a couple of places that we check for. There are a couple of places we check for pallor, which is a shortage of blood in the body. The most common place we use is what they are showing in this image. We just depress the lower eyelid. That is the most common place to check for pallor, which is shortage of blood. Depress with your finger. We usually use the two thumb. We use the two thumb and we depress the lower eyelid at the same time. So we look into the two lower eyelids at the same time. Look at this one, look at this one. And we're also comparing the two of them to make sure that they are uniform. So the two of them are pale. They are whitish. What we mean by pale is being whitish. When we see them pale or whitish, it means the person doesn't have enough blood. Doesn't have a shortage of blood. Doesn't have a shortage of blood. So what is normal color supposed to be? A normal color is supposed to be pinkish. It's supposed to be from pink to reddish, somewhere between pink and red. That is normal color between pink and red. That's what our lower eyelid, the conjunctiva, that's how it's supposed to be. So when we depress this, it is white, we say it is pale, pallor, so shortage of blood. Okay, there are other places we can check for pallor apart from the eyes, but we'll go through them. Subsequently. Other places we can check for pallor. This includes the tongue. We can check for pallor in the tongue. The tongue will also become the tongue can also become pale. The tongue can also become pale. If we're able to look through the palate, we check the soft palate. The soft palate will also become pale. Then oral mucosa, all of them will become pale. But another important area where you will pick shortage of blood is on the palm, of the patient. So you tell the patient to show you his or her palm, the person will show you his or her palm. You see that the palm of that person will become pale, become whitish. So when you see those things, you should be able to pick that this person is having shortage of blood. So the first thing I've talked about is the hair, fluffiness of the hair. The second thing I've talked about is pallor. The person is pale. So the third thing we've got to talk about is what we are seeing here. Look at this. You guys should look at this, the eye of this patient. You can see these places that are supposed to be whitish. All of these places that are supposed to be whitish in this patient, they have orange color. They have orange color. Instead of being white, it has orange color. So how do we check for this? This is called jaundice. It's called jaundice. So any patient that has this type of eyes, the person is jaundice. Patient is jaundice. So how do we check for jaundice? You guys will do all of this practice in the hospital. How do we check for jaundice? You use your index finger, the index finger of your left hand, and your left thumb. You use the index finger of your left hand and your left thumb. You grab the upper eyelid and you pull them up. As you're pulling them up, you stretch out your right hand and tell the patient to look your right hand. As the patient is looking your right hand, you now bring your right hand down. Tell the patient to follow your right hand. So the patient will just looking at your right hand. You are pulling the upper eyelid up, and the person will follow your right hand. You bring this right hand. You bring this right hand from up to down. As the person is looking at it, you'll be able to see all the white part of the eye very well. So if we are looking at the white part of the eye very well, you'll be able to pick jaundice if it is there. If the eye is completely white, the patient doesn't have jaundice. If the eye look like orange color, we say the person has jaundice. So how many things have we talked about now in general physical examination? Talk about the hair, if it is fluffy or not. We talk about if the person is pale, pallor. We are not talking about jaundice, if it is there or not. So the fourth thing we want to talk about now is the cyanosis I was talking about. Sorry that I didn't talk about the eye before going to the mouth. Because we want to, on the physical examination, we must follow that sequence. That is why we said it is from head to toe. We said it is from head to toe. So we must follow that sequence. We cannot go to the mouth without talking about the eyes. So fluffy hair, after fluffy hair, we go to the eyes. So into the eyes, we will check for pallor, if the patient is pale or not. After checking for pallor, if the patient is pale or not, we'll now check for jaundice. After checking for jaundice, we'll now come to the mouth to check for cyanosis. So we're talking about cyanosis before. We said cyanosis is the bluish discoloration of the mouth. So we see the mouth, the lips, the upper and lower lips to become bluish. And in that mouth as well, if we tell the patient to stick out the tongue will also become bluish. Even the buccal mucosa, the inside of the mouth, they will all become bluish. So when a patient has, there are two types of cyanosis. Cyanosis can be central or peripheral. Central cyanosis means the problem is coming from the heart and the lungs. The problem is coming from the heart and the lungs. Peripheral cyanosis means that is what we call vasoconstriction. The blood vessels have constricted, so they are not permitting enough blood to flow to the distal extremities. They're not permitting blood to flow to the fingers. They're not permitting the blood to flow to the toes. So that is vasoconstriction. So when do we see peripheral cyanosis? In somebody who is feeling cold. If somebody is feeling cold, the extremities, the blood vessels will become constricted, and the extremities will appear cold, and they will have bluish discoloration. Somebody who is also having low BP can also have peripheral cyanosis. So where do we see central cyanosis? If the problem is in the heart or on the lungs, we see it on the lips, as we are seeing in this patient. The lips, the upper and lower lips become bluish. The tongue, as we have said before, become bluish. The conjunctiva will also become bluish. The inside of the mouth will become bluish. So all of these places will become bluish. What about peripheral cyanosis? The one we said is from either the person is having cold or the person is having low BP. So we'll see it on the extremities, as we are seeing in this patient. The fingers will become bluish and the toes will become bluish. We can also have a combination of central and peripheral with a mixed cyanosis. A mixed cyanosis, we are going to see what we are seeing in the mouth, and we're also going to see what we are seeing in the hand, the fingers, and the toe. So this is the fourth thing we are looking into in general physical examination. The first one is hair, if it is fluffy or not. The second one is we're looking if the patient is pale or not. The third one is we're looking for jaundice. And the fourth one now is cyanosis. Okay, fine. The next thing we want to talk about after this, the fifth thing that we're going to look at is lymph nodes. We're going to look at the lymph node. I told you it must be in that sequence. We can't jump. We can't jump because we can't go back. So we look at the head, fluffy. We look at the eyes. The eyes we are looking for pallor. We are looking for jaundice. Look at the mouth. We are looking for cyanosis. We are looking for cyanosis. So these are the basic things. These are the basic things. Even though in the mouth there are other things that we can look for, which at your level now, I don't want to bog you down with so many stuff. Let's know some basic things. Later we'll go into maybe a more difficult stuff. There are other things like oral thrush, like oral leukoplakia and other things. But for now, let's just learn basic things. We have oral thrush, we have dental caries and other things that we can look for and pick in the mouth. So let's not talk about it. Okay, still in the mouth, another basic thing that is important that we shouldn't miss at all again, and that one you need it, is hydration status. So that is the fifth thing that we'll be talking about, hydration status. So the first one is hair, is it fluffy or not? The second one is pallor. The third one is jaundice. The fourth one is cyanosis. The fifth one is hydration status. So look at the mouth. Tell the patient to open the mouth. If the patient open the mouth, look at the mouth. Look at the tongue. Tell the person to try to raise the tongue up. The person will open mouth, look through the mouth, tell the person to try to raise the tongue up because you want to see under the tongues. So when you look at that, what are you looking for? You're simply looking for saliva. So if you have enough saliva in the mouth, then the person is well hydrated. If there are no saliva, if you can't find saliva in the mouth, it means the person is dehydrated. Because if the person have adequate hydration means enough water in the blood and in the body. So if the person have enough water in the blood and in the body, you will find saliva inside the mouth. Or if there's not enough water in the blood and the body, the person will not have water in the mouth, like saliva in the mouth. The person will not have saliva in the mouth. So in that case, we say the person is dehydrated. So that is the fifth thing. Fluffiness of hair, pallor, jaundice, cyanosis, hydration status. Hydration status. That's the fifth thing. So what about the 16th? The 16th is what we have in here. What we have in lymph nodes. Want to palpate for lymph nodes. Want to palpate for lymph nodes. But lymph node will tell us some certain things. There are some sicknesses that somebody will have. The person will have enlarged lymph node. Someone that is having infection, for example, infection in the ear, will have enlarged lymph node in the cervical area, the neck, the lymph node in the neck. So when you palpate it, you feel that it is swollen. You palpate it, you feel that it is swollen. And if it's caused by an infection, it will become painful. The person will feel pain. The person will feel pain. So we have to palpate for the lymph nodes if the lymph nodes are enlarged and if they are also painful. So how do you palpate it? We palpate from what cause submental, palpate under the jaw, the jaw. We'll palpate it to see if there's any swelling there. We'll palpate around the ear. One we call preauricular. We'll palpate on the mandible. We'll palpate on the neck. Check the upper neck, the middle neck, and the lower neck to see if we pick any swelling. If it is swollen, we'll ask if it is painful. Ask the patient if he's feeling pain there or not. So that is lymph nodes. So after lymph nodes, okay, that's not the only place we are going to check lymph node anyway. After lymph node on the head and neck, we'll check the lymph node on the armpits. Just use our hand and palpate on the armpit to check if we pick any lymph node. So after palpating this place, the next place we are going to look for is the hand. Like as we have said before, we'll tell the patient to show us his or her palm. What are we looking for in the palm? We want to see if it is pale, as we have said before, pallor. So if it is pale, it's telling us, it's supporting that this patient has anemia, shortage of blood. So after that, we said tell the patient to rotate his finger. When you rotate it, we are looking at the nails. Is there any dystrophic nail? Or is there any clubbing of the nail? At the hospital, you will be shown what a nail clubbing is, which you are going to see and you are going to get used to it. There are some pathologies that will cause nail clubbing, which we'll be talking about in our subsequent class in some of them. But look at this nail. The nail is dystrophic. The nail is dystrophic. So all this pathology can tell us maybe what does this patient have this, does this patient has the other illness. As you can see, even in the second image here, this nail is infected. There's serious infection going on in the nail. So I want to look at these things and pick them. It will help to tell us, what is going on with this patient. Then there's nail clubbing, which you get to learn in the hospital. You just try to put the nail of the patient, two nails of the patient together to check if it is clubbing or not. So after checking the nails, what else do we need to do in our general physical examination? We get to the pelvic area, the inguinal region. So you also get to know in the inguinal region, the pelvic area, the inguinal region, we want to palpate in those areas to also check if the lymph nodes are swollen or not. So I don't have the picture of the inguinal region palpation. To check for if the lymph nodes are swollen or not. So after that, the next thing we'll go is to the foot to palpate for edema. Going to go to palpate for edema. So as you are seeing in this image now, the foot on the left side of this screen is normal, but the foot on the right side of the screen is swollen. It is swollen. So we try to palpate at the bony prominences. To palpate at the bony prominences, we check if there's edema, if there's any swollen, if it is swollen, if there's any swelling in that leg, palpate if there's any edema. So now, if you palpate for edema, the edema can be classified as what we call as pitting or non-pitting edema. So a pitting edema is the one we are seeing here. If you press it, the area will go in, will go inside. There will be an indentation or depression in the area we have palpated. So palpate the area, it will depress, go in. When we see that, it tells us that it is pitting edema. When we try to press in and there is no, it didn't go in, the press didn't depress, we said it is non-pitting edema. The causes are different. The causes are different. In the non-pitting edema, there are things like lymphedema, which you will learn later as you move on in the class. So that's why I don't want to disturb you much in these courses, because for now, as of this early stage, you might not be able to understand what a lymphedema is, what a myxedema is. No. So that's why I don't want to bother you with the courses. But just know that there is pitting edema and there is non-pitting edema. A pitting edema will depress when you press it, and non-pitting edema will not depress when you press it. So, and this edema can be graded as grade 1, grade 2, and grade 3, grade 4, depending on how depressed, when you press your hand, how inside the place will go in. So that are the basic, what we have talked about now are the basic of general physical examination. Basic. Just basic general physical examination. Let's recap again from head to toe. Number one, we said we are going to check for fluffiness of hair. And we said fluffiness of hair is going to tell us about the protein level, the amount of protein in this patient's body. If the hair is fluffy, it means there's low protein level or there's low albumin level. What can cause low protein level and low albumin level? One, the most common cause is, okay, apart from malnutrition will be the most common cause, because we have a lot of people, especially in this our country where the economy is hard, who are not really eating balanced diet. They are not eating balanced diet. If somebody is eating carbohydrate food from morning to night, every day, after a couple of months, that person will come down with low protein level. And when you check the hair might be fluffy. So malnutrition, because of fluffy hair, low protein level. Somebody who has liver problem. When we go into more classes, we will see that the liver actually synthesizes protein. Liver produces protein to be in the blood. So when we have a liver problem, the hair will be fluffy. When we have a kidney problem, the hair will be fluffy. So we'll talk about fluffy hair and what can cause fluffy hair. So the next one, we'll go into the eyes. In the eyes, we want to look at pallor. By depressing the lower eyelid, we look at the pallor. Is this person, pallor means pale or white. If the lower eyelid is white, we say the person has anemia, which is shortage of blood. So in the same eye, we say we are going to look for jaundice. Jaundice means the white part of the eyeball, the white part of the eyeball, the color will change from being white to being orange color, from being white to being orange color. When we see that orange color, we say that the person has jaundice. We say the person has jaundice. So after jaundice, we go into the mouth, and we said in the mouth, we are going to look for the lips. We are going to look for cyanosis. We We're going to look for cyanosis, if the person is cyanosed or not. So cyanosis means the lips are going to be bluish. The lips are going to be bluish. The tongue will also be bluish. Still in the mouth, we say we are going to look for hydration status of this patient. If we see saliva, we see a lot of saliva in the tongue and in the mouth, we say the person is hydrated. If there's not enough saliva, we say the person is dehydrated. So we also go ahead to talk about lymph nodes. So we say we are going to palpate the lymph nodes, starting from the submental area, the preauricular area, the upper part of the cervical area, which is upper neck, the middle part of the cervical area, which is middle neck, and the lower part of the cervical area, which is the lower neck. So after that, we are going to palpate the lymph node on the axillary region, or the armpit, or the lymph node on the axillary region. After that, we'll move to the hand. So in the hand, we say we are going to look for the same pallor, nails. We're going to look for pallor. After that, we tell the patient to rotate the hand the other way around so that we're going to see the dorsal aspect. So we look at the nails, if the nails are dystrophic or not. If the nails are dystrophic or not, or if the patient also has finger clubbing or not. So after that, we'll go to the pelvic area. We check the inguinal area for lymphadenopathy. So we check for lymphadenopathy at the inguinal area. So after that, we'll now check for edema. Then edema, we say if it is pitting edema or non-pitting edema. Remember that one of the most common cause of pitting edema is heart failure. It's heart failure. One of the most common cause of pitting edema is heart failure. Kidney problem can also cause pitting edema, pitting edema on the legs. Edema can also be generalized, where all the whole part of the body is swollen. But when it is only on the legs, we say it is localized only on the lower limb. Okay, so that is the end of the basic general physical examination. Let us take question now. Please ask your question, type in the chat box or unmute yourself and speak. Titi Lola, if you have a question, please ask, type in the chat box. Temitope, please ask question. Blessing, ask question. Okay, if you don't have question, just indicate in the chat box that you don't have question. Esther, any question? Esther, if you have question, indicate. If you don't have question, also indicate. All right, so if there's no question, we'll end the class here today. Tomorrow, we'll move on to the next examination, which will be cardiovascular examination in that sequence. All right, good night.